first Wednesday of the month, which means it's time for the Slocum Dickson Medical Moment with the Slocum Dickson Medical Group. And in studio with me, happy to have you back in studio. It's been a minute. Sarah is back from Slocum Dickson. Good morning.
Good morning. Thanks for having me.
Of course. And how has it been going?
It's good, but, I would give a reminder to everyone out there that regardless of whether you're vaccinated, please remember all healthcare facilities are under a mask order. So it has changed in a lot of places, but not when you come to the doctor.
Right. It's a good place to want to wear the mask if we're being
really
real.
Good place to wear your mask.
So Slocum Dickson Medical Group, you can find them in New Hartford. You can find them online, sdmg.com. But you brought somebody very cool with you today.
I did. He is a pretty cool guy.
Yeah. Do you want to introduce who you brought with you today?
Sure. This is Dr. Patrick Burke, and he is our new neurologist.
Well, good morning. How are you doing?
I'm doing fine. Thank you.
Did you think that radio interview would be part of getting the gig at Slocum?
Not at the time, no.
Well, welcome to KISS and to Utica. And why did you choose Slocum Dickson Medical Group?
Sure. So when I interviewed, everyone was very accommodating and generous, and it seemed to sort of really fit well with my personality. Plus, being physician-run, I think we could institute real change for our patients a lot quicker than normal.
Yeah. I think that's one of the biggest pluses to Slocum Dickson is the fact that everybody is under one roof. All of you work together. And if you can't be seen by this one, you're going to be walk down the hall to the next person who's the expert in that. And I think that's really cool. But explain to people, what does it actually mean to do what you do?
To be a neurologist?
Yeah.
Okay.
Yeah, I know that's a very broad question, but I feel like it's something that if you're listening and you're like, I don't know, could I be a neurologist? Could I do it? What exactly does it mean?
So it means to treat disorders of the central or the peripheral nervous system, so things of the brain, spinal cord, or the nerves that are in your arms and legs. Common disorders that we see are chronic headaches, migraines, seizures, epilepsy, neuropathy, numbness in the fingers, toes, feet, weaknesses in your arms or legs, like a drop foot, carpal tunnel syndrome, multiple sclerosis, and many, many, many other disorders of the central nervous system.
And it's basically a lot of things that you don't want to leave untreated.
Correct.
You want to make sure that if any of those symptoms are popping up, you do make a call because it's pretty serious.
It can be, yes.
Yeah. So you can now see Dr. Patrick Burke at Slocum Dickson Medical Group. And what exactly happens during an appointment with you?
Sure.
How does that work?
So the first thing that you would want to do is collect a history from the patient and see what's going on, see how long they've had symptoms X, Y, and Z, and what treatments they've tried, what doctors they've seen, what medications they're on.
Yeah.
And what's the most important thing to the patient going forward, whether that's figuring out what caused a particular ailment, treatment for it, how to try to fix it as best you can or treat it as best you can. And then you go through an exam, and I go through a particular algorithm for each patient, depending on what I see, and try to come up with a good clinical diagnosis that wraps everything together.
So did you just always know it was you were going to be a neurologist, or did that happen by going through school and really learning about it?
I guess I kind of always knew. It just sort of was a calling. I did a lot of research in psychology and neuroscience, physiology, and then it seemed to be the path that felt the most right.
Yeah, I think whenever I talk to any of the doctors, that question is always how did you land in that world? It just depends on what happens as you go through and what feels right. If you are interested, or if you feel like any of the things that Dr. Patrick Burke just talked about sound like something that you should get checked out, he's taking new patients.
Absolutely.
SDMG.com. You can find all of the details there. Also, I'll be resharing this interview so you can hear all of the facts again. But thank you so much for coming in and doing your radio tour.
No problem.
It is the Slocum Dickson Medical Moment. We do this every first Wednesday of the month.